Hi, my name is Craig Hasking. I'm COO for MedEvolve, and we've set up a webinar today to walk you through how to minimize contact during patient check-in. Today, joining me are two of my colleagues with Health iPass, Imran and Ryan. But today, we'd like to really highlight some of the points that we're seeing in the market around the crisis and the COVID-19 pandemic. Clearly, you know about the change of your environment. You know that you're seeing fewer patients. We know that for many of you, you've closed doors because of the low traffic, and we know that you're beginning to use other methods like telemedicine and how the industry has embraced that. But it's safe to say that everything that we thought about normal has changed. There's a new normal for everything. What we'd like to do is just kind of highlight some of the things that we know that will be important. We've already outlined in our first webinar that you may have already walked through around forecasting and planning. As you know, to get your costs aligned, you need to quickly look at your patient volume. Those are clinical, new consults, but how are you using your financial planning tools to begin to prepare you for this COVID-19 environment, and then really what will become the planning to get you out of the COVID-19. This list is just a list of AMA tools that have been outlined in terms of things to familiarize yourself at the practice level. One of the areas I'm highlighting, number 9, use of digital health tools. Clearly, telemedicine is a big part of what's in place today, but really there's much more around this in terms of the COVID-19 exposure, and highlighting number 14 is what are the new clinical protocols for admitting patients back to your office. And really that's what this is about. How can we begin helping you with planning in terms of technology and process to plan for that day? The first part of that, as we see it, is that you need to be rescheduling your canceled appointments. That's the first cue for your patients that you're planning for a new normal. It starts from a practice level of engaging with your patients, and really it's the use of tools and technology to confirm that, whether that's through email, text, or phone call, but basically to set that expectation that the next 60 days this will be rescheduled. And really, as we work through that, the specific appointment is the basis for how you engage with a patient. It shows them you're thinking ahead, you're looking ahead. It's a way to create questions and dialogues, even in this downturn environment. It's going to be a critical part of your planning to get that on your forecast for financial planning to see the what if in the next 60 days and 90 days. So when you look at what's going to be needed for extra measures, clearly the guidelines that AMA has outlined is there's just as much a concern for the professionals exposure as there is for the patient. So how do you minimize non-clinical staff and patient interaction to make sure that you're addressing that peace of mind? Everyone's going through social distancing right now in our country. We've seen a great awakening in terms of us rallying around that so that we can prevent the continued spread of the COVID-19 virus. But it is very important that these guidelines be embraced, because that is really what's going to get your patient population comfortable with coming in again. What does that look like in terms of the temperature being tested before they walk in? What's the process we're going to follow? How can you prepare to receive to your practice patients? Clearly, the CDC has outlined what that looks like. Signs and posters at entrances, put hygiene first in terms of those things that are needed just to accommodate the patient. But really what we want to talk to you about is how do we minimize the exposure during check-in? There's two parts of that as we've defined it with our partnership with Health iPass, is the complete financial clearance, what's needed pre-registration in terms of a process, forms, credit card intake for new patients, all of the information that needs to be collected for demographics. And then the actual second step, which is how do they go about the check-in? What does that look like? Where they used to go to a front desk, how will that work, including is your parking lot now your new waiting room? So what I'd like to do now is kind of turn it over to my colleagues at Health iPass. I'll let Imran kind of introduce the concept of touch-free check-in. Imran, over to you.
Hey guys, thanks Craig. I appreciate the intro. First off, I wanted to thank you and thank you for the partnership with MedEvolve. We're hand in glove, so to speak, and in a COVID-19 world, that analogy holds more bearing. But I want to talk a little bit about what a touch-free check-in experience is going to look like and how things are going to change in a post-COVID-19 world, where we probably are still dealing with some of the after effects of COVID-19, because a lot of practices, and we've seen many groups, they've canceled all of their non-emergency elective procedures and are suffering financially. And depending on when things are going to reopen, we expect to see that there's going to be a shift from the telemedicine, which is occurring right now, back to the in-office experience. And what can practices do right now to really transform that in-office experience to one that is safe? And when I say safe, it's safe for your patients, but also for your staff. And so those are the two elements that we've tried to encapsulate when we think about the Health iPass check-in experience. And I'm happy to have my colleague, Ryan Navratil, who is our VP of Product and Client Success. And what we're going to do is talk through a little bit about what we envision the post-COVID-19 world to be and how we envision things to really maximize the efficiency of what we can do during that time period. And so, the biggest thing that comes to mind is what can we do to really reduce and eliminate touch? And when I say touch, I'm thinking of when a patient comes into the office. Today, the normal experience is that patient walks to the front desk, they're handed a clipboard, they're handed a pen, they're filling out forms, they're sitting at a table or a chair alongside other patients in that waiting room. And right now, in the new normal of 6-foot social distancing guidelines, according to the CDC and others, we need to really be prepared to eliminate any touch where we can. And that's what Craig had mentioned earlier, which is the embracing of the digital check-in experience. And what we've really tried to do in that digital check-in experience is really put together a way for practices to, one, improve the workflow of the practice so that it's streamlined, it's easy for the patients to access, but also to really address the main issues that the practice is worrying about. How can we collect demographics in an easy, defined way? How can we collect insurance card? How can we make sure we do that financial clearance that Craig was talking about? Make sure that we can collect the dollars without exchanging credit card information. All of those elements are really some of the elements that we've thought through. And I'm actually going to pass the reins to you, Ryan, because you've spent a lot of time thinking about this. And I'd love if you can show folks listening in the elements that we've described and how we've tried to address it. But at the end of the day, we're all going to have to work together to really make sure that we're doing things in the safety of our clients and in the best interests of our practices. So, Ryan, over to you.
Thanks very much, Imran. Appreciate that. What we've really tried to do is extend the functionality that we've been working on at Health iPass throughout the history of our company and turn that into a really robust experience that it's not only a pre-arrival experience, but one that looks similar to a lot of other tools that patients are very used to using. So taking our cues and habits from other parts of the marketplace and bringing those into a clinical environment to do exactly what you said, which is increasing the operational efficiency of a clinic. So I'm actually going to take you through a very simple, high-level view of what we do and what we believe is going to be a great solution to this immediate need and long-term need. Of course, the beginning of any patient process pre-arrival is patient engagement. We have a robust system of patient outreach, whether that be an appointment reminder, a follow-up, that allows us to leverage email, SMS, voice to communicate with the patient. In this case, 5, 7, 3 days before time of service, or even 2 hours before that appointment, we can send a communication, in this case, SMS, to a patient, letting them know it's time to check in. They can skip the line, they can avoid going into the clinic, and that patient can, to their benefit, begin the check-in process. And so what you saw was a typical entry point to give that patient the opportunity to do some very light authentication. We want to make sure that identity and privacy are protected through this process. And the high level is demographics, insurance, payments, and any other intake, whether it be forms, signatures for consent, et cetera. So those are the elements that we need to recreate, and we need to do so in a way that's very simple for patients. So what you're seeing is a typical entry point for ID and demographic verification. Patients can take a photo, whether that's your policy or whether or not it makes a more personal experience, that's configurable. In this case, patients going through the process of updating their contact information, both for insurance verification on the back end, but also so you can continue to interact with that patient in a way that's going to be most successful. For those clinics who are maintaining MIPS MACRA, any additional information, we do also offer additional fields for capture. So things around primary language, for example, if you happen to have a multilingual patient population, making sure that's captured along the process, and then emergency contact, other information that you'd want to capture. Now, all this information, patients driving on their own, their autofill on their cell phone can take care of most of it. This information is stored in Health iPass, but also written back into MedEvolve. So we're trying not to create additional work. We are eliminating that need to do any paper scanning, additional handling by front desk staff by doing this. But that's pretty standard, pretty straightforward. Confirming patients' demographics is really the first step. We're also pulling insurance information into our system, being very transparent about patients' benefits, reducing the amount of handling time from a check-in, putting that into the patient's hands to do things like their own verification of insurance. And if you're requiring to eliminate the need to exchange materials between patients and your staff, the ability to take a photo of front and back of an insurance card as well. So dual benefit now for reducing contact, also reducing the amount of handling time for that patient's claims in the back end. From a payment clearance standpoint, this should look very familiar to anyone who's made a payment online. It's important that if a patient's being asked to pay a bill, that we can surface that information back to them. Be very transparent about cost to visit to eliminate any back and forth and any friction to ultimately making a payment. Any cards that a patient's used before that we've securely stored in our system are eligible to be used again. In this case, paying with a credit card through a normal channel, getting a receipt in real time from Health iPass to confirm that email address, just to make sure that that patient feels confident that it's a secure and effective system. At which point, we take a large part of what is considered patient handling time at time of service, digitize it, and bring it to a pre-arrival state. And that is consent forms, medical history forms, any forms that can be digitized that would have otherwise lived in a clipboard, caused a patient to spend an unnecessary amount of time in a waiting room. That's something that we can bring into our system in Health iPass. And like you would in any normal sort of digital form, capture a signature, and then store that back and write it back into MedEvolve. So that at the end of the process, what we really want to do is make sure that the patient has any specific instructions about waiting in a parking lot. You're going to get a phone call from one of our staff members. We'll send you a text. All that's contained in those visit instructions to make sure that those guidelines that you set for your practice and how to handle patients in this environment are being followed. So really helping that patient shepherd through that process. So that's all of the patient-facing component. It can be completed in 60 seconds or less. I do want to spend just a quick moment on the tools that we provide for clinic staff to manage this remotely, because it's just as important to have visibility into that patient process for your staff to effectively manage that workflow. So what you're seeing is our dashboard with what you might consider a launch pad or a command center for this process. And I'll quickly talk through the basics of how those messages and that workflow gets into patients' hands. So rule engines on the back end will send any number of communications back to a patient, contextualized around the things that they have to complete. Should a patient show up and you want to really eliminate the need to interact physically with that patient, you can also launch any of those workflows you just saw through this dashboard. So for example, sending a check-in package like you just saw to a patient, making sure you have the proper contact information on hand, and then tracking where they are in that process so you know if you need to assist them or send follow-up communications. So our process of showing you as a clinic administrator or staff member exactly what that patient is experiencing and where they need support without having to actually be in the same room as that patient's really key. And in this case, to be able to select things on hand, make that flexible, make that process something that you can control from just this dashboard is really the key here. So that's the high level of how all these things fit together. You can assume that, of course, just like every practice is unique and has unique constraints, everything that you just saw is highly configurable to the needs of the practice to make sure that this is a successful process.
Thanks, Ryan. And as you guys saw, some of the elements that we're really trying to touch on are related very directly and address some of the needs in a COVID-19 world. But even in a post-COVID-19 world, when we adjust to a new normal, this is, I think, a really nice way to get that practice efficiency and workflow going. And so we've tried to build something as a toolkit that addresses the issue not just for the short term, but for the long term. But we want to make sure that our practices are equipped with all the tools that are necessary to not only succeed, but thrive during this time period, so that we can all come out on the other side much stronger. So Craig, I'm going to defer back to you.
Thanks, Imran. Thanks, Ryan. Another question. Again, I think you did an outstanding job outlining the patient engagement portion on the handheld. But when we talked about the parking lot, so you went through the pre-reg, you went through all the setup of financial clearance, all the check-in process, but the step of actually arriving in the building. Just talk about that a little bit. So again, with MedEvolve, the patient has the ability, again, based on these rules, of being notified, wait in your car until you arrive. And so the arrival part of this, how would that be communicated back to the front office?
Sure. Part of this process is a very simple notification system, a dashboard that will tell the staff who are managing that workflow not only where that patient is in the check-in process, but also when it's completed, giving them the option of a review step for checking through demographics or insurance if there's more that needs to be done, but basically arriving that patient both in our system and MedEvolve in real time. So that seamless integration Imran just mentioned allows us to do that. So it's open to whatever makes the most sense, but that signal coming back from Health iPass in tandem with MedEvolve is that same signal that would tell staff that now it's time for an outreach. And as you saw, we're going out of our way to make sure we have that preferred method of communication on hand for anyone who wants to communicate with that patient, sending a text message, making a phone call saying, we're ready to see you now with that arrival signal from both of our systems. It's a way that you could use, like you said, the parking lot as the waiting room.
Yeah, that's great. So yeah, thank you so much. I mean, we could spend a lot more time going through the details. We wanted to just give you a little bit of a taste of the concepts around a touch-free check-in, how this could be basically the tool to reopen your office in this reduced, highly crisis-oriented COVID-19 world. And then as Imran outlined, even as we return back to normal. But I think the new normal that we're defining here is probably going to last longer than anyone wants. So again, this has been a very engaging conversation between Health iPass and MedEvolve. We'd like it to be a very engaging conversation with you. So any of you all that have questions, please take advantage of contacting us. We'd love to visit with you about this. If you're not familiar with this platform, even with MedEvolve, we could visit with you on the concepts and processes, because much of this is appropriate for other platforms as well. But we wanted to highlight how we use Health iPass and how MedEvolve as a partnership really does provide a unique opportunity in this post-COVID-19 environment. Again, thank you for your time. Have a great day. We look forward to talking to you very soon.
Thanks, guys.
Thank you.